This is the Rapid Infuser, also known as the Level 1. I'll be showing you how we set it up in our trauma rooms. To prime it, we always like to prime it with crystalloids first, typically NS, as it's the only crystalloid compatible with blood. I know in trauma we like to use LR, but with the calcium in LR, it can mix with the citrate that's in blood and create blood clots before they go into the patient. So I'll first show you how to prime it. We're going to spike the bags and burp them to get all the air out. Now you notice there's 3 or 4 different hooks here for the volume of fluids given. Liter bags will go all the way on top, where something smaller like blood would go on the bottom. These are the inner hooks that we put our bags on. The most top one that's clear is for our liter bags. The blood one is 350 cc's and it goes on the bottom. There are other various hooks. We don't typically use those in the ED. Okay. I prefer to prime the level 1 when it's outside of the chambers that level 1 gives us, just because it's easier, gets rid of all the air. You can make sure excess air is all flushed out prior to setting it up, making the transition from fluids to the patient smoother without worrying about air getting in the line ahead of time. So we're going to start by opening up the clamps. Once we get the chambers up, we can do them one at a time. We have to do one at a time. Clamp that guy, so this one can open up without it getting any backflow into the other bags. Okay. Once you're primed, you're ready to start setting it up. Close this in here. They made it simple so you can follow the numbers. Start with 1. Once your bags are primed and ready to go, you're ready to put the tubing into the level 1 itself. You're going to start numeric order. It starts with 1, then 2, 3, and 4. Once everything's ready to go, we like to make sure that it's at least open on one side and then clamped everywhere else. Whoop. Not that one. They're both open. This one's open. This one should be open. And then we can go ahead and turn it on. Once the infuser's on, it's going to start heating up the fluids or blood or whatever's in it after it passes through. It usually starts around 25, 26 degrees Celsius and gets up to 41 or 42 degrees Celsius. Once the level 1 is running in our patients, whether it's fluids, both ideally crystalloids or blood, it's important for the nurse to switch back and forth as these generally run out faster. These are liter bags of fluids, so we usually have more time. When we have only 350 cc's of blood, it goes into the patient much faster. Essentially, one bag will be running while pressurized. The RN's responsibility is to make sure that everything is running fine with the level 1. It's at an adequate temperature. It's warm. Right now it's 40 degrees Celsius. And that the IV is running well, the flow is good, and it's not infiltrating. Otherwise, that'll be a big problem when it's pressures and flows that high. Once the fluid or the blood is finished, it's important to turn off the pressure, clamp the bag, unclamp the next bag, and then turn on that pressure. While maintaining IV access and doing all this, the nurse should then start to take this bag out and then put it in with what's next. If they prefer to flush it through with fluids, blood with fluids, that's fine, as long as it's NS. Or if they want to rotate between FFP and RBCs, that is also fine, as those are compatible. Platelets are not compatible through the level 1. Those have to go through a different access at any given time. While managing the level 1, it is a one-to-one nurse job, meaning that this is the only thing they should be doing. There is no other documentation, medication administration, or even holding C-spine during the trauma assessment. This is the only thing they should be paying attention to, as it's extremely dangerous for it to infiltrate or to lose access or to have a problem with it. These are the IV connectors, or the J-loops that we call them in the ED. Once we get our own IVs established in the patient, this is what we typically hook our IVs up to. This is the level 1 free hanging through an IV of a regular rate. Just strips in the same way. Obviously, the higher the gravity, the better. This is the rate of the flow when the level 1 is not plugged in, as it won't work if it's not plugged in. When we go to the OR, or when we cannot travel with the level 1, we can take the tubing with us, but we cannot run it while it's pressurized. We'll have to take a pressure bag. This is the rate of the level 1 while it's on. Just give it a minute to squeeze the bag. Much faster there. What we're supposed to do in our trauma patients once we're going to use the level 1 is we remove the hub from the catheter and then connect the level 1 tubing to the regular J-loop. Now you'll notice there's a lot more of an increase in rate, pressure for more flow into the patient. This is a free hanging, and this is a pressure. The level 1 can be used through almost any of our IVs that are large bore, 18 minimum up to our 14 gauge. It can go through any central line, cordis, and even an IO, preferably the humeral head.